So is LPN or LVN still worth it in today's nursing climate? Stay tuned to find out. Hey you guys, me Adam Deshawn here with another video. So this question has come to me and we were actually discussing this topic at work the other night. Is it still worth it to become an LPN or LVN in 2023 as we go into 2024? So for me, short answer is absolutely. Yes, it's still worth it. Like, what do you mean? What are you saying? Yes, of course. The way that nobody has nurses, the way that everybody needs nurses, yes, it is still worth it to become an LPN or an LVN today. Pause for a second. What are y'all feeling about this hair? Now, so the Beyonce video, the Beyonce movie's coming out tomorrow. So I had to do something real quick with my hair. I did this myself. So y'all, let me know in the comments what y'all think. I'm kind of living for it. They're probably only going to be up for a few weeks, but let me know. But anyway, back to the subject at hand. Yes, it is worth it to become an LPN in my opinion. The LPNs that I work with now are cleaning up. Like they're making some of the LPNs are probably coming in making more money than I am right now, and I'm an RN. So absolutely, I think it's still worth it for you to become an LPN. So here are a few reasons why. So the first reason, LPNs are some of the most highest. What is the word I'm trying to say? Some of the most efficient nurses that I've ever worked with. Now, I was in LPN. Now, in LPN school, they really train you to really be task-oriented. Now, being task-oriented can be a good thing or a bad thing. You have to be mindful. You still need to assess and consider all different dynamics when taking care of a patient. So being task-oriented is not always a bad thing. But when I say task-oriented, LPNs are almost always more sufficient on skills. Maybe that's a better way to put it. Like if you need an IV put in, if you need a peg hung, if you need wound care done, if you need a maybe even an IV started, baby, LPNs, like they're on it. It's because they are that task nurse, right? RNs come in more to assess depending on the situation you're in, but LPNs, baby, they got those clinical skills for you. Trust and believe. Don't get it twisted. The LPNs got the clinical skills. Now, also, LPNs can do a really broad spectrum, has a really broad spectrum of knowledge. Now, depending on where you work, there's not many things that LPNs can't do. The biggest thing that LPNs cannot do, regardless of what setting, they cannot quote unquote assess. That needs to be an RN. They cannot generally take care of a new admission or an unstable patient. Now, you can take that however you take that. I know a lot of LPNs are already doing this, but technically by a lot of nursing perimeters or nursing scopes, they can't do these things. But as far as giving PO meds, even a lot of IV medication now, LPNs can absolutely do. So you just really have to look up in your state at your board of nursing what LPNs can and cannot do. Now in the hospitals, we have welcomed the LPNs back into the hospitals, which is so exciting because we started to do what we call team nursing. What is team nursing? Team nursing is basically you have an LPN and an RN who are caring for an allotment of patients, right? The LPN really generally takes care of a lot of the task-oriented things like meds, IV, certain little things that the RN kind of hone towards the charting, the documentation, the assessment, and of course the RN may take over some things that the LPN can't do, such as blood products, maybe giving IV narcotics, high risk medication. So this team nursing, when done properly, is an excellent tool in, I think, all healthcare settings, in my opinion. Now, also too, another reason why I say LPN is like the GOAT right now is because like those of you guys who are doing the per diem nursing apps, like there's a lot of them out there. eShift, Shift Key, Clipboard. There's a lot of these per diem nursing apps out there that I never could really get into when I was on there because I was an RN. Now, I had the opportunity to look at my best friend. My best friend's an LPN. I got the opportunity to look at her app, her shift key, like she had shifts out the wazoo. And I didn't. Why? Because they wanted LPNs. Of course, they would have to, what the facility needed at the time was only, LPN was sufficient. They didn't need an RN to do these things. So my shift key was kind of dry because they would have to technically pay me more. So the LPNs was popping, mine was dry as fuck. And it is what it is, which is one reason why I just really didn't do shift key or do those per diem agencies for that long. So you guys, absolutely, I still think it is worth it becoming an LPN today or an LVN today, regardless of where you are in the country. Now, granted, if you want to work, and I used to say, well, if you wanted to work in the hospital, you needed to go back to get your RN. But here in Tennessee, we are utilizing LPNs in on the med surg floor again. We're utilizing them, and they're succeeding, because a lot of what we were doing, a lot of what I was doing on the med surg floor was really nothing special that an LPN could not do. So absolutely, it's worth it. If you're trying to get an LPN school, go for it. If you're in LPN or LVN school, good luck to you. Y'all get this money, because that money's out here to be got. Those of you guys who have not already done so, please like and subscribe. Like this video, subscribe to the channel, comment below to tell me what you guys think about. Is it still worth it to become an LPN, or would you just go straight to RN, or whatever the case may be? Follow me on Instagram at Adam Deshawn, and I will see you guys in the next one. Happy nursing. Bye.